Hi everybody, Dr. Daniel. Today I'm speaking about treatment of menstrual migraine. Migraine is present in 12% of the world population, and 25% of women and 6% of men have migraine. Menstrual migraine is for women one of the longest, most severe, hardest to treat type of headaches they get during the month. So what is the treatment of menstrual migraine? A summary statement would be you should do a migraine lifestyle and take care of yourself, and then for 5 to 7 days you can either use an NSAID like naproxen or take one of the triptans like Provotriptin. And then patients who have worse headache than that should probably get on a daily preventive drug, and that's the bottom line on treatment of that. So how do you define menstrual migraine? Well, the International Classification of Headaches says there are 2 types of headaches relating to menstruation. One type is called pure menstrual migraine, and that's found in 7 to 14% of women. And those are ladies that just have migraine during their menstrual cycle only. They don't have it other times during the month. It's pretty rare, as you can see, from 7 to 14%. Then about half of women who have migraine during their cycle have what's called menstrual-related migraine with or without aura. And these are ladies who have migraine during their cycle, but also have headaches during the rest of the month at other times. All right, so the migraine lifestyle is important. And first of all, I think women should plan ahead for this time to take care of themselves during their cycle. Particularly if they have regular cycles, they would know that maybe Wednesday or Thursday are going to start. Well, that wouldn't be a good day to have a big meeting schedule or some kind of paper due unless you can set that off some other time. Or try to schedule your life so you can take it easier during that time. There should be attention paid to eating regularly, to sleep regularly, try to get 7 or 8 hours of sleep every night, to exercise regularly, because exercise is very important in helping sleep, deal with anxiety, and also works for headache prevention as well. You should not take any type of trigger, get involved with any kind of trigger that sets your migraine off if you can, eating chocolate, red wine, or things like that. You have a chart, maybe your barometric pressure. You can do that on your cell phone daily. If pressure drops, a lot of folks will get headache during that time. You can treat that early with a drug. So you want to pay attention to your lifestyle issues. It's very important, especially during that time. All right, then if you're going to treat, many patients just treat episodically when headaches come on, and first they'll use what's called an NSAID. That's a mnemonic, which means non-steroidal anti-inflammatory drug. And an example there would be naproxen. And when naproxen first came out, it was a drug only written by doctor's prescription. It came out as 550 milligrams. But later, it was brought out over the counter as ibuprofen, and that's like a 200 milligram dose. But for treatment of migraine, we try to get the doctor-related prescription of 550. You could take that twice a day for 5 to 7 days. Or you could take one of your favorite acute therapy triptans. The triptan drugs came out 30 years ago, and they are the best acute therapy drugs for migraine. They're all generic, relatively cheap on insurance plans. 5 of the drugs are acute onset, work in 30 minutes as oral drugs, and the 2 of the drugs go onset in 1 to 2 hours. The 2 drugs I'm thinking of there, Provotriptin and Provotriptin, take 1 to 2 hours to work, but Provotriptin lasts for a duration of 6 hours, and Provotriptin is the king of the hill of a drug here for prevention, lasts 26 hours. So ladies that already have like Maxalt, Rizatriptin, and they're using that for acute therapy of migraine. If they have migraine without RI type headaches, they have them during the month, they have them during the menstrual cycle only, they may be able to get by just using 1 triptan in that fashion. They would take the Rizatriptin or Maxalt at onset. But during their headache time, during the menstrual headache time, 5 or 7 days, they could use 1 or 2 a day for several days to try to get rid of the headaches. There's been a great outreach to use the drug Provotriptin, which has been studied and was given a type A type rating by the American Headache Association, the American Academy of Neurology, but not by the FDA for treatment. Provotriptin is a long-acting drug. You take 1 or 2 of those for 5 to 7 days. And then folks who have more headache than that probably ought to be considered to get on a preventive drug. And preventive drugs we're talking about here are just normal, old-timey preventive drugs that we use for migraine, such as Topamax, which comes as Topamax alone, or it comes long-acting like Udexy or Trokendi. You can use Enderall, or one of the beta blockers, or amitriptyline, which are good drugs for prevention. Really, in today's world, we're using a lot of the CGRP drugs like Ajovy or Aimovig. Those are given by injection once a month, most of them. One of them goes every 3 months. For the 4 drugs in that class, 3 of them are given subcutaneous injection, and one of them as an IV injection, like in the doctor's office or IV infusion area. And these drugs have been marvelous for treating migraine. And for folks who have bad menstrual migraine, you should consider one of those drugs, I would think. It might be helpful to chart your headaches. That can be done just on a piece of paper or with a monthly chart, so you can buy that kind of thing. Or really best in today's world, there are a number of free cell phone apps that are available that you could chart your migraine headache occurrence and also your menstrual cycles, the drug you gave, and how long the headaches lasted and how well they were treated. You can show that to your doctor, and also be helpful to you if you find you're having severe headaches during the menstrual time. You have it 3 months in a row. That may tell you that you probably have menstrually related migraine of some sort. I have a web page on that. It's called List of Free Migraine Cell Apps. Instead, drmigraine.com online. You can check that out if you want to. And then there's a thing called mini prevention as applied to menstrual headaches, where the acute therapy drugs can be given in rotation either 5 or 7 days, maybe once or twice a day. And the drugs people rotate through there are NSAIDs, as I said, triptans. You can use timolol eye drops, can be helpful. You can use dihydroergotamine, which is given as an intramuscular shot, like in the leg, or as a nasal spray Migranol, which can be helpful. There are also 2 devices for acute therapy migraine that can be used at that time, called Cephally, which is an electronic little band that stimulates the trigeminal nerve in the forehead. Or there's a thing called Gammacore, which is a vagal nerve stimulator in the neck, which has been helpful for acute therapy. I don't really know of any data on the use of CGRP drugs or Cephally or Gammacore for menstrual migraine that have been approved and are helpful for acute migraine otherwise. And then if you're going to have headaches that bad for a period of time, you might consider getting on one of the daily drugs for like a month at a time. Doctors have used estrogens in this fashion. They have estrogens that are given as an implant, injection, vaginal inserts. The problem with that is that American Cancer Society says that they're all class A carcinogens, and they can aggravate the migraine for some persons. And they also can cause abortion and problems like that. So I'm going to read you something that happened years ago that American Academy of Neurology elected Elizabeth Loder, L-O-D-E-R, who's a professor at Harvard, to get a committee together and study the issue of menstrual migraine using estrogen drugs. And they looked at all the literature, published this article in the journal Headache, and they came out with what's called a summary statement, which I'm going to read to you on my cell phone. Hormonal treatment of migraine is not a first-line treatment strategy for most women with migraine. Evidence is lacking regarding its long-term use and harms, and migraine is a contraindication indication for use of exogenous estrogen in all women with migraine, and those especially age 35 or older. The harm-to-benefit balances of several traditional non-hormonal therapies are better established. So there you have an expert headache doctor, particularly for women, making a statement in charge of this committee regarding the use of estrogen for menstrual migraine. So good luck to all you women who have migraine, particularly the ones who have severe migraines during their cycle. Please click on like down there. Click on subscribe so we can follow each other. God bless all you folks who have migraine, women that have menstrual migraine. And I will see you again on the next